Good health is one of the fundamentals that our individuals in our communities or society need to achieve in order to maintain an average level of living. This morning, we were walking through these double doors at the British medical jungle to discuss some of the factors and issues related to the causes and the presence of malaria in Uganda. However, before we proceed to speak to the expatriates in there from different backgrounds, we'd like to speak to the organizer, the gentleman who came up with the idea of discussing various and different factors affecting the health in Uganda. Hello. I'll quickly take a seat.
Okay.
Thank you. Pleased to meet you.
Nice to meet you.
Would you kindly introduce yourself to our viewers?
My name is Moses Waswa. I am the UK lead for Uganda-UK Health Alliance, which is the UK government and Uganda government working together to promote healthcare.
Wow, what led you into the role? Why the UK-Uganda Health Alliance?
So the UK-Uganda Health Alliance was set up by someone called Lord Nigel Crisp, and it's chaired by, who is the former Chief Executive of National Health Service. It's chaired by Professor Jed Band, who is the Director for Health Education in England. That's the body which trains doctors and nurses. So the idea was, what can the UK learn from resource-limited settings, like countries like Uganda? And so the idea is to see how we can exchange doctors there and Ugandans here. So that's the long-term plan.
Wow. What are the main issues that you highlight? How do you choose a particular illness that you discuss for that particular summit? Because this is the fourth time you're doing this.
Yes, this is the fourth summit we have, and this time we're looking at workforce. We are aware that nurses and doctors are very limited, especially in countries like Uganda, but also in the UK. We are short of doctors and nurses, where we are. And healthcare workers are very important to well-being of everyone. So we are looking at how can we improve this, prevent disease, but also support the population in terms of treatment. So that's where I'm focusing on workforce at this time.
Okay. I understand one of the issues you're going to highlight in today's summit are getting people who originally came from Uganda, came here, they trained as doctors and nurses, and you're thinking of taking them back home to work there. How is that going to work?
I'll call them the diasporas. They're very important to me because most of the reasons why countries like Uganda are struggling, many of their health workers are leaving and coming to countries like UK for many reasons. But majority of them, when they reach here, they're happy to go back and support, but they need a regulated framework to help them. And that's why the Alliance is developing a platform to help them with the Ministry of Health in Uganda. So we hope them going back to offer skills, offer some sort of learning, and also bring back that to the NHS here. So the UK benefits as well. So it's not the other way around. And the diaspora are unique because we know what we're facing in our countries, and we're agents of change.
Thank you so much. Ladies and gentlemen, that is Mr. Moses Waswa on the organizing committee of today's summit. I'd like to find out from him, on behalf of our viewers, I do suppose, the different expatriates that you brought from Uganda. What did you choose? What did you put into consideration as you selected who should come and participate in today's summit?
Obviously, we've invited the Minister of Health, and we are pleased to have Dr. Diana Twine, our Permanent Secretary. We invited the members of Parliament. Here we are linking in with the UK government in terms of all-party parliamentary group on malaria. That's the members of Parliament here. And we're pleased to have Honorable Moses Balieku, who chairs the parliamentary group on malaria in Uganda. Malaria is one of the biggest killers in Africa, especially for young children under the age of 5. So we're seeing how we can tackle this sort of diseases. But also we are looking at who is involved in running these organizations, who is involved in running these hospitals. So the Chief Executive of MUGGA has been invited, and other Chief Executives of these hospitals. What can we learn from the UK? And also I'm trying to bring the senior leaders of UK to learn from Uganda.
And according to what we've had so far, this year's slogan is "The stopping of malaria starts with you, or begins with me." How viable is that going to be?
We believe malaria, everyone knows malaria is a big killer, especially in Africa. We are trying to see how can we make people empowered to take actions. Malaria can be preventable. For example, sleeping under nets, making sure you spray your place. The ministry was highlighting ways people can actually prevent malaria. And also, as a diaspora, do you take your anti-malarias when you go back to your communities? So that's very important. Sometimes we forget and we import malaria back to the UK.
Thank you so much, Moses. Ladies and gentlemen, we have the PS from the Ministry of Health and Honorable Moses Balieku, who sits on the committee that eradicates malaria in Uganda in the House of Parliament. Let's take a look at their contributions during this. Right here in the United Kingdom, and of course, I'm more than excited to speak to the chair of the Parliament of Uganda on the malaria board, on the malaria board, Honorable Moses Maliego. Hello and welcome to the program. We are so excited and definitely looking forward to broadcasting your presentation that you just gave to the people of the United Kingdom. Now, quickly, I would like to find out, why is it that people in Uganda are still dying from malaria and at a very high percentage?
Actually, people are not dying at a very high percentage. You had our presentation on the malaria has gone drastically down. There are areas in Uganda where we don't have any malaria. So our efforts are being realized. The only issue we can say is that it's not yet completely eliminated, but the figures have gone drastically down. Because now everybody has a mosquito net. We're doing mosquito nets to each and every individual in the country. And we're still going to do it even every year, but we need to have more measures that eradicate the disease.
Oh, thank you. And I do understand that theme is here that there is eradication of malaria starts with
Malaria-free country is your
What sort of educational campaigns have you put in place?
No, right now, as we speak, in every school, in every society, malaria has become an issue. That's why maybe in the UK today, we did summits to ensure that we pass over the message that everybody gets know that malaria is everybody's business. It is now both private and public sector. Everybody is concerned about it.
When you mention about the schools that malaria is being told, that is quite obvious that the school pupils, will pick up and know what to do. But how about their parents, especially those individuals in private areas of the country?
One of the other causes of malaria is poverty. So when you say that in villages and whatnot, once people are household income grows, even malaria reduces. Because that means people have access to anti-malarial, mosquito nets, cutting bushes, spraying. So all factors are put together and then it comes down.
Okay, I can see a lot of people are waiting to speak to you, Honorable Member of Parliament. Before I release you, how relevant was this summit to an ordinary Ugandan?
Let me show. When I get information here as a leader, I disseminate the information back home. So it was very good that we all met here, and we are from different backgrounds, and you see that we are all fighting for one noble cause.
Thank you so much, ladies and gentlemen. That was Honorable Moses Maliego speaking about malaria on behalf of Uganda, East Africa, and of course Africa at large. I'm still your presenter, Nancy MUGGA, right here on your program, The Inspiring. Ladies and gentlemen, I'm still your presenter, Nancy MUGGA, right here at the 4th East African Summit in London. And of course, Uganda being one of the countries in the East African region, I'm more than excited to introduce you to one of the doctors who traveled all the way from Uganda to speak at this spectacular summit in regard to the prevention of malaria in Uganda. Hello, Doctor.
Hello.
Would you kindly introduce yourself to our viewers?
My name is Diana Atwine. I'm the Permanent Secretary, Minister of Health.
And we understand you come from the Department of Ministry of Health, but what is your relevance to this convention?
I was invited to attend the Health Summit that is bringing together the three countries, Kenya, Uganda, and Tanzania. But also to look at how we can strengthen the collaboration. I also came as part of because I'm a co-chair on UK-Uganda Alliance. Every year we have our board meeting. So that's one of the reasons that brought me here, but also to attend this important summit where we look at the collaboration, how we can really strengthen the collaboration and support, how we can leverage on the friendship, the partnerships that exist, so that we really strengthen our services in our country, but also exchange information. Because also I know that UK can learn from Uganda, Uganda can learn from UK.
Thank you so much. Why do you think malaria should be given as much attention as it has received?
Malaria is the biggest killer in our country. If you look at the topmost killer of our people, especially children and women, is malaria. Yet we know all the mechanism of how we can, prevent malaria. But also, I want to say that UK being the second largest funder to Global Fund has worked with us to make sure that we put in place mechanism to prevent but also to treat malaria. And so it is #1 agenda as far as prevention is concerned in our country.
Let's take a look at your presentation at today's summit.
Of course, I was basically talking about how we can work together with developed countries and mainly look at how we can strengthen e-health, because digital health now is the thing. Where we do not have enough human resource, we can use actually digital health to help us to exchange information. We can get in real-time information. We can actually monitor the performance of our workers. We can actually ensure that we get quality data in time for planning and for budgeting. Therefore, e-health, for me, if it is just one bullet thing that we can get from our partners, that would be a very, very, very big output for us, and it will improve the care. The other thing is really to talk about regulation. We want really to work with partners to strengthen the regulatory framework of our countries, both in medicines, practice, and otherwise. And once we strengthen that, we'll be able to actually bring the quality of care in our health system.
Thank you so much, Doctor. Before I leave you to go, what are you taking back home for an ordinary Ugandan, especially one who cannot access e-services?
What the take-home message is that we can foster partnerships, we can work together, but we must define what we want. Now, for a common person who is not able to be in all this, is really to know that the best way is to prevent diseases, because that is the cheapest way to help government to make sure that we reduce on the disease burden. And once we reduce on the disease burden, we shall be able to save money to provide more tertiary and more sophisticated service delivery for the non-communicable diseases. As you know, now it is on the rise. So to a common man, we really want everyone to really take charge of their health, of knowing that health begins at home and health is their personal responsibility.
Thank you. Thank you so much, ladies and gentlemen. That was our Permanent Secretary from the Ministry of Health, Diana Atula.
Thank you.
Thank you so much.
Thank you.
And that was the contribution from Honorable Members of Parliament, Moses Walieko, and of course the Permanent Secretary from the Ministry of Health, as they continually speak to the public about the eradication and the prevalence of malaria in Uganda. Of course, we had representatives from other countries in the East African region, which included Kenya and Tanzania. One of their messages involving calling upon communities to come and work with the government, and of course emphasizing on the fact that the eradication of malaria should begin with you as an individual. Thank you so much for watching, ladies and gentlemen. I remain your presenter, Nancy MUGGA, right here at the 4th East African Health Summit right here in London, United Kingdom. See you next year.